All right, good evening, classmates. My name is Marcus, and welcome to my house, and welcome to my bar. And with this here, we're going to talk about everybody's favorite topic. We're going to talk about alcohol, how it relates to the body. A lot of people want to know, is this beneficial to me to drink? If I don't drink, am I missing out on any benefits? And are the benefits that people are getting due to other lifestyle factors? So we're going to try to get through and look at some studies and see the pros and cons and if you should be drinking or not. So there have been studies that have shown that are a few benefits from drinking moderately. So before we continue, we've got to figure out what is a drink and what is moderate. So a drink is, we have here is 5 ounces of wine, 12 ounces of beer, and 1.5 ounces of liquor. So it's 80 proof, 40% alcohol, just your typical bourbon, tequila, vodka, whichever one's your favorite. Bourbon and tequila being mine. That is one drink. Now, what is moderate? The Dietary Guidelines of America has defined moderate drinking as 1 drink a day for women and 2 drinks a day for men. And that is not a average. So if you do not drink for 4 days and you're a man, and then the 5th day you drink 10 drinks, you can't say, I've been drinking 2 drinks for a week, right? That's binge drinking, and we're going to talk about that later. So it's 1 for women, 2 a day for men. There's a reason for this, before you get mad at me, ladies. There is an enzyme in our stomach called alcohol dehydrogenase, and what that does is it breaks down the alcohol in our body. Men actually produce more of this enzyme to women, which is why the dietary guidelines made that definition. Now, tolerance is based on many different factors, such as health, age, genetics, body composition, family history. So it is possible that you're going to have a different definition of moderate for men and women depending on those factors. So we're going to talk about some of the benefits. So there have been over 100 studies that have shown an inverse association between light and moderate drinking and the risk of cardiovascular events. We're just going to talk about 2 of those studies right now. One thing you want to look at with these studies and studies in general is there's a lot of factors, but one, you want to have a lot of people and you want to have a lot of time going by so you can see the effects over a vast amount of time. First study was a study in Japan. It was 10 years and there were 97,000 participants, and it showed that over time there was a 12 to 20% decreased risk in all-cause mortality in those who drank 2 drinks or less a day. We actually had a study in America that was a 9-year study which had close to 500,000 participants, and the ages were 30 to 104, and it showed a 30 to 40% risk reduction in cardiovascular events. So I'm sure you're kind of confused, like, why is this happening with people who drink, and this is helping them reduce their risk from all-cause mortality and cardiovascular events. Well, moderate alcohol consumption has been linked to improvements in factors that cause blood clotting. And these small changes prevent blood clots from forming that can block the arteries and cause heart attacks and strokes. There's also been a positive correlation with moderate drinking and type 2 diabetes. There was a 12-year study in the Netherlands with 370,000 individuals, and it showed a 30% reduced risk of type 2 diabetes. So very confusing, right? You think it's alcohol as something toxic, but now we're seeing that if you don't drink that much, we're seeing benefits of it. So we're going to talk about the risk. And the first thing we need to state is that all of those studies acknowledge that all-cause mortality increased with heavier drinking or binge drinking, which is 4 drinks or more a day. So this is not one of those cases in nutrition where more of something is actually better. One fact is that alcohol cannot be stored in the body. Once it enters the body, it's actually absorbed before your nutrients, and your body's trying to process it and get it out as quick as possible because it's potentially toxic. We know what happens when we start drinking alcohol from personal experience. If you do drink, right? You start to have impaired judgment, your ambitions get relaxed. And further, later on to the day or to the night, you start getting a little bit double vision, it gets hard to walk. And if we get to that extreme point, you actually can go unconscious. And that's just a safety mechanism for your body so you don't drink anymore and kill yourself. For those of you who work out, you like to stay fit, uh, alcohol has been shown to impair muscle protein synthesis, which is the whole reason you're working out. That's the muscle building process. It's also been shown to impair the wound healing process. So if you have an injury, if you're drinking alcohol, you're not going to recover as fast. Both of those studies were done in rodents, just to be transparent, but that is how a lot of our studies are done today. Alcohol also contributes to fat in the abdominal region, which can create that beer belly that we all are trying to avoid or get rid of. Now, the biggest thing that you can have from constantly drinking is getting addicted to alcohol and becoming an alcoholic, suffering from alcoholism. And there's many different downsides to that. One is cirrhosis, where your liver cells turn orange, they die, they harden, and they may never work again. Okay. Next thing is chronic alcoholics have an increased susceptibility to viral and bacterial infections, and that's because drinking alcohol impairs your immune system. So your defenses are down when you're consuming all this alcohol, to all those sicknesses. And then alcoholism can just have a major impact on your personal life, your job, your family, your mental health. So hearing all of that, what do we do? Do we drink or do we not drink? So bottom line, if you are not drinking and you're hearing this or you've been reading studies and you want to know if you should drink or not, go talk to your healthcare provider. Ask them, they know your overall health, and they will be the one to determine if it's going to be detrimental if you start consuming alcohol, especially if you already have one of those chronic diseases such as cancer or diabetes. If you're at a healthy weight, physically active, you don't smoke, you eat right, you don't have a history of heart disease, then I don't think drinking alcohol is going to help you that much or going to hurt you that much if you're moderately drinking alcohol. So we're talking about 2 drinks or less a day. So if you have all those factors, a little bit of alcohol isn't going to make you that much healthy, isn't going to make you that much worse. So myself, the American Heart Association, and the National Heart, Lung, and Blood Institute do not recommend you start drinking to prevent any of these diseases. But if you want to do it moderately, then there's nothing wrong with that. So stay thirsty, my friends.